medulla. Hello everyone, this is Dr. Jawad. In this short video, I'm going to talk about a system that we have that's geared up for our stress response, whether it be physical stress, mental stress, environmental stress, basically the stress that we have in everyday life. Okay, and how our body adapts to that is through a hormone, basically a glandular system called the adrenal glands. Now, the adrenal glands are otherwise termed as our stress glands. Now, where are the adrenal glands located? The adrenal glands are about the size of your thumb or about the size of quarters, and they rest on top of the kidneys. Yes, we have two of them, okay? So the quarter-shaped glands, they rest on top of the kidneys, and they're involved with our stress response to basically maintain our body's homeostatic state. Now, what's unique about the adrenal glands, the adrenal glands in of itself has two types of tissue. The outermost portion is called the cortex. Okay, and that's composed of glandular tissue. But the innermost portion, that's referred to as the medulla. And what's unique about the medulla, that's not glandular tissue, it's actually nervous tissue. And that is responsible for releasing what's called catecholamines. Now, catecholamines, that's the adrenaline response. Okay, so that's your fight or flight response. So when you have again, when the bear is attacking us, that's the adrenaline that makes us, again, fight or flight. And that's what's released in the medulla is the norepinephrine, which, again, works in conjunction with our dopamine system, but also, too, the epinephrine system, which will help stimulate the nervous system to make us go. So I want to talk about the hormones that are released from the cortex, from the gland tissue. And there's three different types. One, glucocorticoids. Next is the mineralocorticoids. And the other kind is the androgens. These are your hormones. Now, keep one thing in mind. All of these hormones, they're made from cholesterol. So we need cholesterol for the production of these hormones in response to the stresses. So if you are taking a cholesterol inhibiting pill, kind of like a statin, okay, this is where you run into problems. This is where you get side effects from the statins, okay? This is where you may get adrenal fatigue. Because, again, the adrenals, which need cholesterol to make our hormones, are not being done. They run out of gas. So, glucocorticoids. Now, the glucocorticoids, it's in the name, cortisol. The main function of cortisol is to influence your blood sugar. Now, one way that you're going to have too much, again, is stress, whether it be physical, mental, or chemical stress. Our body needs energy to fuel itself, especially the brain. So you're going to have over an abundance of cortisol being released from the adrenal glands, and this is where you may get adrenal burnout. This is where you might become a type 2 diabetic, or you may have too much insulin floating around your systems due to stressors, and this is where you get an increase in belly fat. Okay? Again, it stabilizes blood sugar. So if you have too much float around, this is where it's going to affect your blood sugar. Also, too, immune suppression. So people who have autoimmune diseases, what do they give them? They give them cortisol. Okay? What happens when you have too much? It actually shuts down the immune response. So this is where you're going to have a side effect of having too much anti-inflammatories if you have an autoimmune disease. Also, too, again, it's a big, powerful influence in the immune response. So this is where if you have too much stressors, this is where you actually get sick because the body just by nature just wants to shut down because you're running it too far. This is where adrenal fatigue comes in. In addition to bone, okay, what's going to happen if you have too much cortisol floating around your system, okay, too much cortisol floating around your system inhibits the absorption of vitamin D3. Now, vitamin D3 pulls calcium from the cell into the bloodstream. Then you have vitamin K2, which actually escorts the calcium into the bone where it should go. So if you have too much cortisol floating around your system, it actually shuts down the absorption. So this is where you get increased bone loss from having too many stressors. Now again, the stressors could be physical, it could be mental, it could be environmental stressors. Okay? Next is the mineralocorticoids. Now the mineralocorticoids, this is your electrolytes. This is your, again, the calciums, the magnesiums, the chlorides, the sodiums, the potassium. These are the electrolytes that we need for cellular function, in particular the aldosterone system of the kidneys. That stabilizes our fluid balances. Now, when you're taking if you're on a heart medication, one of the medications they do is they give you a diuretic. Okay, so if you have a diuretic, what you're doing, you're shunting out all these important electrolytes for cellular function. Okay, so this is where problems occur by taking like diuretics if you're trying to control your blood pressure. So if you're on diuretics trying to control your blood pressure, you want to make sure that you increase the intake of these essential electrolytes to help balance out the system. In addition to, we have our androgens. Now the androgens, these are male hormones. Okay, males, we make them, females make them. Males make them exponentially more than females, but again, females, you do produce androgens, your male sex hormone, and particularly testosterone, because testosterone is needed for muscle recuperation, for muscle building. Okay, again, females don't have as much as men do, obviously, okay, but you still need it for muscle tone. So also do androgens. This produces the androgens. Now, what happens when females go into menopause, okay, all the hormones that are grabbed by the ovaries shut down, roughly about the age of about 52, give or take. So where do you think all those hormones, the availability of those hormones go to? They make a shift and they go to the adrenal system. Now, the problem is, if you have adrenal fatigue going into menopause, you're not producing enough of these hormones as is. So then your body makes this dynamic shift, and then this is where problems occur postmenopausal women, and particularly the women who are on statin medications. This is where the postmenopause situation, it just becomes havoc. Okay? Also too, DHEA. Now DHEA, it's a hormone, and it's a precursor for the production of the natural hormones that we make daily. Testosterones, our estrogens, progesterones. This is why, if you're experiencing adrenal fatigue, this is why having a supplement of DHEA is very important to take, especially in postmenopausal women, because again, you still want to build up those hormones that are being produced in your postmenopausal years because they shut down from the ovaries. Okay? So again, this is the adrenal glands. The adrenal glands are an important gland. It's our stress gland. It's involved in physical, mental, or chemical stress. And make sure you take care of them. And I'll see you in the next video. Thank you. Hello, this is Dr. Jawad. Please subscribe to my channel for more up-to-date videos. And thanks for watching.